Okay, good morning. My name is Nabila Putri Larasati, NPM 56. I'm going to show the spread of tuberculosis through the air. What is tuberculosis TBC? Tuberculosis, or often called TB, is an infectious disease caused by the bacterium Mycobacterium tuberculosis. This disease can attack any organ of the body, but most often occurs in the lungs. TB is included in the category of communicable disease and is very easily spread through the air when someone who is infected coughs, sneezes, or even just talks. Tuberculosis infection. TBC bacteria can survive in the air for several hours and can be spread to other people through breathing. Factors such as poorly ventilated rooms, roads, and poor environmental conditions can affect the spread of TB. Therefore, it is important to keep the environment clean and avoid contact with infected people. Tuberculosis cases in Indonesia. At present, it is known that Indonesia ranks second after India in terms of tuberculosis TB, namely with a total of 169,000 cases and 93,000 deaths per year, or the equivalent of 12 deaths per hour, as quoted from the Global TB report for 2020. It is also known that the highest number of TB cases in the world affects the productive age group, especially those aged 45 to 50 years. Tuberculosis infection. How does it spread? TB transmission generally occurs through the air when an active TB patient specialist matches are blamed. When coughing or sneezing, the TB bacteria will also come out through the mucus and be carried into the air. Furthermore, TB bacteria will enter other people's bodies through the air they breathe. Factors that influence the spread of TB through the air include population density, lack of air ventilation, and poor hygiene. For example, cases of TB transmission once occurred in a person with very close environmental condition and poor ventilation. Tuberculosis infected prisoners can easily transmit the bacteria to fellow prisoners through the air. Tuberculosis infection. The symptoms of tuberculosis. The early symptoms of TB are often unspecific and similar to those of the common cold, such as dry cough, fever, fatigue, and loss of appetite. The symptoms can persist for weeks or even months without proper treatment. Over time, TB symptoms can get worse and cause shortness or breath, coughing up blood when coughing, and chest pain. Tuberculosis prevention. First, the BCG, basically vaccination can provide protection against tuberculosis in children However, this vaccination does not provide complete protection and is not effective in preventing TB infection in adults. Therefore, it is important to avoid contact with people who are infected with TB and important to the immune system by maintaining a healthy lifestyle such as exercise and eating a healthy diet. Second, people who are at risk of getting TB, such as health workers or people who live in endemic areas, can be given TB prevention drugs for 6 and 9 months. These drugs can help prevent TB infection from turning into active disease. By taking these steps, we can prevent the spread of tuberculosis through the air and reduce the risk of getting this disease. Tuberculosis diagnosis. The process of diagnosing TB involves several tests and medical examination. The tuberculin test, TST, or skin test is used to find out if a person is infected with TB bacteria. If the test results are positive, then a blood test or sputum test can be done to make sure the infection is active or not. If the diagnosis of tuberculosis is confirmed, then treatment should be started immediately. The TB treatment usually involves a combination of antibiotics for at least 6 months. Medication used include isoniazid, rifampicin, pyrazinamide, and ethambutol. The duration of treatment might vary depending on the type of TB and the severity of the disease. It is important to follow the medication schedules strictly and avoid discontinuing in pregnancy, as it can lead a drug resistance and relapse. Conclusion: tuberculosis or TB is an infectious disease caused by the Mycobacterium tuberculosis. This disease can attack any organ of the body, but usually affects the lungs. TB is very easily spread through the air when an infected person coughs or sneezes. To prevent the spread of TB, there are several steps that can be taken, such as vaccination, keeping the environment clean, and avoiding contact with infected people. If a person is diagnosed with TB, then treatment must be started immediately and must be continued until it is finished to prevent drug resistance. Remember that prevention is the key to controlling the spread of TB. Thank you.